Jeff, I think we're ready for you.
Okay, thanks, Susan. Welcome, everyone. Good afternoon. We're really pleased to welcome you to the first in our What's in Your First Aid Kit series. We're really grateful to have Dr. Jamie Jacobs with us today. I'm going to introduce Dr. Jacobs in a minute. I'm Jeff Travers. I'm the Chief Operating Officer of Cancer Support Community. I live in Washington, D.C. It's a pleasure to welcome you all to this inaugural event of the series. I want to give a shout out to my colleagues for doing a lot of hard work to put this together for you all. And we're really grateful that you're here to participate in it. So Cancer Support Community is a global nonprofit network. We have 175 locations across the globe, but primarily in North America. We have cancer support communities, and we have Gilda's Clubs affiliates, hospital and clinic partnerships. Together with the headquarters organization, we deliver more than $50 million in free support and navigation services to patients and families. We have a toll-free helpline and produced that served 45,000 people last year. That's not in my little notes, but I'm really proud of that. We produce award-winning educational and digital resources that reach more than 1 million people each year. We also conduct cutting-edge research at our Research and Training Institute in Philadelphia on the emotional, psychosocial, and financial journey of cancer patients, and advocate at all levels of government through our Cancer Policy Institute for policies to help individuals whose lives have been disrupted by cancer. Our belief is that community is stronger than cancer, and that is what has led us to create the 7-session program for oncology professionals. We recognize that you, the cancer care community, are on the front lines. The care you provide impacts cancer patients, survivors, and caregivers from the moment of diagnosis through the end of life. We thank you for your commitment, your passion, and your expertise. It's my pleasure to introduce our presenter for the inaugural series, Dr. Jamie Jacobs. Dr. Jacobs is a clinical psychologist at the Massachusetts General Hospital Cancer Center and an assistant professor of psychology in the Department of Psychiatry at Harvard Medical School. She's a clinical researcher and the director of the Caregiver Research Program in the Mass General Hospital Cancer Outcomes Research and Education Program, otherwise known as CORE. Dr. Jacobs' research encompasses patient-centered work focused on adherence to treatment and symptom management, caregiver-centered research focused on reducing anxiety and improving coping for the family and friends for someone living with cancer. Dr. Jacobs develops and tests evidence-based therapeutic approaches that are accessible and scalable. And that's speaking our language, Dr. Jacobs. In the psychiatric oncology service at Mass General Hospital, she specializes in cognitive behavioral therapy to improve coping and adjustment during and after cancer, as well as at the end of life. Dr. Jacobs received her degree from the University of Miami and completed fellowships at the National Institutes of Health and the Massachusetts General Hospital. So with that, I'll welcome you and I'll express my appreciation to you, Dr. Jacobs, for being with us today. Thank you.
Thank you so much, Jeff. Thank you, Susan and Kara, all for organizing this to the cancer support community. And I was noticing in the chat where people are calling in from or zooming in from. So I'm up in Boston, outside of Boston, and I'm going to share my slides with you all. Okay, so hopefully you're seeing that. So I'm going to talk today, what's in your first aid kit, really about boosting resilience and boosting, sort of buffering the effects of stress, if you will. I think that all of us are somewhat familiar with the feeling of stress over the past year or so. I think this was sort of in line with the cancer support community's mission to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. And I have no disclosures. So I just wanted to go over first what really is stress. How do we define stress in the literature? And it's an individual cognitively appraises the situation as a threat to the self and survival, and then this threat exceeds their perceived coping resources, just meaning that to some degree, you're feeling overwhelmed if you're here by the amount of things going on in your life or the external pressures, and that has exceeded your feeling that you can sort of get through this. And we're here today to talk about what are the other things maybe that you can apply to help you get through that. So we'll talk about stress. What is stress? Which I think is just I sort of geek out on talking about stress in the body and how that actually manifests. We'll talk about resilience and how to boost resilience by expanding your toolkit. And then at the end, I'm going to sort of challenge all of you to set an intention for self-care and share that with each other. And there'll be some points of interaction throughout this. So hopefully you'll all humor me and write into the chat and answer some polls as we go. We're going to start a little bit differently. I want you to engage with me in a short imagery exercise. So if you'll close your eyes and just imagine, if you will, there is a lemon in front of you, bright, shiny, waxy lemon on a clean white plate. And maybe you pick that lemon up in your hand, you bring it to your nose and you take a whiff, smelling the citrusy scent. And then taking a knife and slicing the lemon open, noticing what it looks like as the juice trickles out, and then taking that lemon and putting it to your mouth, taking a bite, sucking out the juice, feeling the tingle on your tongue as you swallow, and feeling that citrusy scent again and that sourness in your mouth. And then, if you will, open your eyes. Now, sometimes when I do this exercise, people tell me that they felt relaxed. And that is a win, I would say. Anything that we can do and you'll feel relaxed is awesome. But I'd love you to write into the chat now what you felt in response to this imagery exercise, if you felt anything in your physical body. And then Kara or Susan will, or I think Susan will call out to me the things that you write in because I can't see the chat while I'm sharing. For instance, did anyone have a puckering, felt like their lips were puckering, or I'll let Susan tell me if there's anything that people are writing in.
Yep. Taste buds were activated. I got a sour taste in my mouth. I could almost feel the bitterness.
And did any of you feel almost like a salivation response? Like your mouth started watering a little bit?
Yes, there was an increase in saliva. The mouth was activated.
Okay. So thanks for writing in and sharing your experiences. The reason I do this is because this is what the stress response is. So notice there was no lemon. Probably, I mean, I don't know, maybe some of you have a lemon there and we're actually doing it with me, but for most of you, I think there was no lemon present. It was only the image of a lemon that you had in your minds. And yet it produced a physical response in the body where your lips puckered or you had that sense of sourness in your mouth. Some of you had an actual salivation response. And so the fact that we can have a physiological response to something imagined, something perceived, is really what happens when we have a stress response. So here you see the reaction on the left to the lemon, and maybe we salivate. And on the right, there's a reaction to stress, a perceived threat in the environment. And the reaction in the state of stress is usually a release of cortisol and adrenaline. So again, a perception of something comfortable might lead to one feeling in your body, and a perception of something threatening, even life-threatening, can lead to this stress response. The stress response, broken down, has two general pathways. And I think it's interesting just to note what these are. So we've all experienced some isolation this year. Perhaps if you are in a state of socioeconomic burden, this has been exacerbated. There have been other life events, people we know around us sick, we've been grieving. And there is associated with this perceived stress, maybe depression, maybe we're not exercising great coping, using some things that, have formed habits over time that feel good in the short term, but in the long term aren't as helpful for us when we're coping with stress. And we process this in the brain, and then two pathways happen. One is the hypothalamic pituitary adrenal axis, where we have the release of cortisol. The other, the autonomic nervous system, where we have the release of adrenaline and other catecholamines that sort of help you activate and help you respond. Several of you might know this as the fight or flight response, or also called fight, flight, or freeze. So what happens, we've all felt it. We've all felt amp, right? You start breathing more heavily, the blood is pumping. Maybe you get those butterflies in your stomach. Maybe you start sweating, but you're really able to do amazing things as a result, and maybe run really fast or lift something heavy. And that has all evolved as a very adaptive response to stress. The problem is that that stress response has saved our lives and allowed us to survive as a species, but it's not really, it doesn't differentiate between the stressor itself. So whether it was a saber-toothed tiger, or now a deadline that's approaching in work, or for what we're experiencing at the moment, the pandemic, we respond in the exact same way. The problem with that is that this pandemic has been a chronic stressor. And what happens when we're chronically stressed is that there's a resistance to stress that we sort of build up in this alarm. We're readying our body. We're having that immediate stress response. That second system, the sympathetic nervous system, is coming online. Then we have a resistance. The body sort of adapts to the stress. And that's when we have the cortisol response that's meant to maintain that stress response over time. But eventually we reach the state of exhaustion where we can no longer maintain this heightened response, and we just end up depleting our energy sources. And I think that several of you that are on this call are probably feeling like you're here. If you're not here, I want to talk to you more and figure out how you didn't get here. But I know that some days I'm definitely feeling here. Like I cannot maintain that heightened level of stress and that heightened level of responsiveness that I'm kicking into high gear day in and day out. I think for those of you on the call who are taking care of cancer patients, who are trying to take care of your families, we mentioned caregivers in the beginning of this, that state of exhaustion is pretty familiar to you. There have been several things that have increased the stress response even more so this year, like witnessing human suffering, the risk of harm to yourself, actually, having to make life and death decisions, managing intense workloads, and even separation from your family at times, or watching other people be separated from their families in the hospital. And the concerns for our patients have also been several, and we've had to help them navigate these challenges, like their increased risk for COVID-19, their increased risk for higher severity of disease should they catch the virus, deferring routine screening for cancer, especially during the surges, delays or omission of care completely, depending on how extreme or what priority they are, and maybe how aggressive their tumor is, and then changes even to surgery options or procedures that may or may not have been available to them at certain times. So this buildup of stress has also sort of entered into the next realm for several of us, which is trauma. Trauma is stress as a result of experiencing or witnessing something that's life-threatening. Sometimes it can result as in response to experiencing something life-threatening for somebody else. So post-traumatic stress disorder, you might experience yourself, which is sort of a re-triggering of the stress response later on, or acute stress disorder, which is just in the moment or a few days after, and then secondary traumatic stress when you're witnessing someone else. Now, when we're talking not necessarily about trauma and you're not having PTSD symptoms, there's still a lot of stress from providing care to others that can cause compassion fatigue and burnout. And I think that's why it's so amazing that this organization put together this series of talks, because I know later on there are talks specifically addressing compassion fatigue. And I hope that my talk today will give you some tools to prevent burnout in the long run, to sort of, by expanding your toolkit, make burnout less likely to happen, or that you're more likely to bounce back faster when you are feeling burned out. So I want to take a moment and poll all of you participating. There are several consequences of stress. When we're feeling stressed, maybe it affects our sleep, maybe it affects our eating habits, maybe we start to feel really down or we feel anxious. So I'm going to ask Susan to kind of display the poll on your screen. There it is. Thank you. And if you can just click on the most prominent thing that you're experiencing right now as a consequence or a result of stress. And then I'm not sure if there's a way to display the results of the poll for everybody.
We have a couple more people to take it, and then Kara will end polling and display it.
And as you're all polling, it's very normal to experience all of these or any one of these. And the goal again today is just to give you some tools to deal with it so that it doesn't become a significant interference in your life. And that's when we differentiate, especially in psychology. Okay, here's the results of the poll. So most people are experiencing weight gain, and then second to that, sleep issues. And that's really common. I mentioned the eating habits, or especially if we're feeling depressed, which that was sort of the third most common response. There's some anhedonia that can go along with that, loss of interest in activities. And so we're more likely to withdraw and less likely to do things that are physically active. And so I hope this tells you that you're not alone here, that these are pretty commonly experienced consequences of stress. Some of the slides towards the end of my talk today will actually address how to re-engage in activities. And so if weight gain is something that you're experiencing, I'll challenge you to choose something that will increase your physical activity. For sleep, the other thing I would say is cognitive behavioral therapy for insomnia in a lot of settings works even better than medication. So if you're more interested in that, that's a great path to pursue. There's some online programs, but general sleep hygiene things, I'm happy to address in some of the Q&A. All right, so the other thing I wanted to say about trauma and resilience before we get into the toolkit itself is that the amazing thing about so many of you and so many people in the world is that we actually are very resilient people. Resilience to some degree is sort of intrinsic. And if you look at these pathways, and Bonanno kind of dedicated his life to studying the trajectories of resilience in different individuals after natural disasters, war, other events. And these are the people that were sort of chronically stressed. But you can see that these are the people that never really had significant disruption in their health, and that includes mental health. And these people recovered without much intervention so that their health improved over time as well. These people who were delayed had a little bit of an increase in post-traumatic stress symptoms after the event. But how many people you can see in these percentages actually recovered or were resilient from the beginning? And it just shows that even without intervention, we are very resilient, but there is a full range of responses to adversity that can develop over time. One of the findings from his work is that optimism contributes to resilience. And that's great if you're a glass half full type person, but what if you're not? Well, the external factors that can boost resilience are what I'm now going to focus on. And the goal is to really increase what we know as the parasympathetic nervous system, the parasympathetic response, sometimes known as the relaxation response. So the opposite, the chart I showed you in the beginning, where we have the sympathetic response, fight or flight, someone's ready to go. We want to sort of increase the opposite response, where we can settle down the release of cortisol and adrenaline, and allow our bodies, sort of tell ourselves, okay, you don't have to be in a chronic state of stress, or that is not going to help you long term. And so we're going to start with some grounding techniques to do this. I'm going to introduce a bit of relaxation training. We'll talk about active coping, how to reframe our thoughts using cognitive restructuring, which is one of the cores of cognitive behavioral therapy. We'll talk about maximizing social support. I'm going to give you the briefest primer you'll ever experience into acceptance and mindfulness. We'll talk about activity planning and pacing, which I think will be helpful for some of you who mentioned weight gain, and then setting an intention for self-care at the end. To start with, and we'll fly through these, but I certainly want, if there's any questions, I'm happy to answer those in the end, and we can talk more in detail about any of these, and I'm sure that my slides will be distributed. But these self-soothing techniques are actually great to use with your patients as well. They're more, I want to differentiate them from relaxation, where that's something that we encourage people to practice over time in order to build up the ability to relax and to sort of master that skill so that you can pull from it when you're feeling stressed. These types of grounding and self-soothing, I think of more as recentering techniques. When things are getting so out of hand that I actually feel panicked, or I'm stuck in an anxiety cycle and a thought worry cycle, and I can't get out of that, then this is a technique that's helpful. And if you all even want to try it quickly, you can just sit comfortably in your chair, breathe slowly and deeply, and then just name 5 things that you see in the room. I see a lamp. I see a plant. I see a notebook and a pen. And then name 5 non-distressing sounds you can hear. So I might hear the hum of the air conditioning or the heat, depending on where you are. I might hear some horns outside. I might hear my kids upstairs crying after their naps. What is it that you hear? 5 non-distressing things then you feel. Something, maybe I feel my feet on the ground. Maybe I feel my hands on the desk in front of me. Now, if you were doing that with me, you probably noticed that in the last 60 seconds of that exercise, you didn't think about anything else. You didn't think about your stress or the pandemic or the patients you have to care for with cancer, because you're focused actually on naming all of these things, and that takes your attention. And that's by design. It's a way to just take your focus off the thing that is stressing you out, that is causing you anxiety, and allowing yourself to recenter on something else. Then often when we come back to that thing, we have a clearer mind, and our body physiologically is a little bit more relaxed. Even if it's not relaxed, it's at least not activated in the way that we are when we feel like we're in that fight or flight response. So again, the point is to activate now the relaxation response, which dampens the stress response. And that is the rationale for relaxation in general. And when I talk about relaxation, I really talk about it being a practice, not necessarily a goal to try to achieve or a state of meditation. The practice of relaxation, similar to mindfulness, is something that we're constantly growing from and learning from. And every time your mind wanders into something else, we just want to bring it back to what you were doing, the relaxation or the meditation, without judgment, without self-criticism, without berating yourself, well, I'm not good at this, but just bring it back to the focus. And I like to think about that as a sort of muscle that you are strengthening. So if I were to do a bicep curl, I would, bring the weight down and I bring it back up. And every time I brought it back up, I would be strengthening my bicep. Well, with mindfulness, every time the mind wanders, I bring it back to the breath. My mind wanders, I bring it back to the breath. And that in itself is strengthening the muscle of mindfulness. So if you think about it in that way, you can think about it as it's sort of good every time your mind wanders because it gives you an opportunity to get stronger. Progressive muscle relaxation is not a type of mindfulness per se, but it's a type of relaxation that I really like to use in the oncology setting because I find that often my patients are having a hard time quieting their mind. And no matter how much I talk to them about strengthening the muscle of mindfulness, it's distressing to have your mind wander off into their worry thoughts. Progressive muscle relaxation is an active type of relaxation. And I also call it PMR for short, it's been around for ages. And it's a really nice way of noticing the difference between tension and relaxation. If you imagine these things on a pendulum, for instance, let's say, or back up for a second, let's say if I'm in a neutral state, and several of you probably are, you might be sitting somewhere watching this talk, and if I said to you, relax, it would be a little bit difficult to go from a sitting position to then relaxing. I mean, maybe you'd sort of slump, or maybe you'd try to rest your hands or put your feet on the ground, but it would be hard to notice the difference between a neutral state and a relaxed state. But if I told you to hold your arms at a 45-degree angle and make fists like this, and to kind of squeeze and hold and tighten, and then hold it again for 3, 2, 1, and relax, you would notice the difference between tension and relaxation. And that's the pendulum idea, that if we get this tense, then the pendulum swings that much in the other direction that we're that relaxed as an opposite state of being. And that's really important because it allows us to more easily notice tension that we might be holding throughout the day. How many of you have gotten home and said, oh my gosh, I've been clenching my jaw all day, or I've been like this with my shoulders, or I have a tension headache. So by doing PMR, we can more easily notice the difference between tension and relaxation. And PMR itself then also gives you a strategy for which to find a state of relaxation. So we're not going to practice this today for the sake of time, but you'll have this exercise and you can Google PMR and probably get lots of guided exercises that people will walk you through with audio. I like to do sometimes this 4 muscle group, starting with the hands and arms. In this position, the face and neck is as weird as you can get your face to look. Your chest, shoulders, and back is just an arch. Note, if you have back issues, be careful of this one. And your thighs, calves, and feet. If these were my feet, these are my legs, my feet would be here kind of flexed and pointed inward. And you can either leave your heels on the ground, or if you want to be adventurous, you can pick your feet up off the ground and turn your feet inward. And you just go through each muscle group once and then repeat for the second time. So you're going to tense and then relax, and then tense and then relax. And different scripts will go through this in more detail or less detail. But again, it's an active relaxation, and people tend to like this one as an intro. I just list on here for your sake other forms of relaxation, other ways you can access relaxation. Diaphragmatic breathing is just belly breathing. There's guided visual imageries or walking meditations, and there's several apps and online programs that can guide you through this. You probably all know so much already about relaxation. You might be using it with your patients, you might be using it with yourself, but I put it up there because I think it's never too late to start, and it's always nice to have the reminder that this can be a really helpful thing. Again, to build up sort of in states where you're not stressed, so that then when you are stressed, you can pull on that skill. So active coping. Now we're moving into our third of the toolkit. Active coping is one of these things that after I show you these slides, you're going to say kind of, well, yeah, duh. But I think that we end up not being aware of the coping strategy we choose so often, and we sometimes don't know how we got there, or we've chosen coping strategies, as I mentioned in the beginning, that maybe feel really good in the short term, but in the long term don't help us or exacerbate the problem. And so I want to challenge you to take this opportunity to look more closely at your coping and be a little bit more proactive. We've all been coping this past year. We've all been getting through really difficult times, and we've all figured out how to do it. And we can all probably do it a little better, or a little bit more with a little bit more awareness. So the first step is, what action can I take to resolve the situation? And that we think of as problem-focused coping. And this comes from coping theory. If I can't resolve the situation though, what can I do to manage the discomfort that I feel? And that is emotion-focused coping. I don't mean emotion-focused coping. Sometimes when I say this to people, they think, oh, I'm not an emotional coper, or I don't act on my emotions. That's actually not what we're saying at all. Emotion-focused coping just means I can't do anything to change it, so I have to figure out how to sit with the stress I feel, or to mitigate it, to ameliorate it in some way so it's not interfering with my life, even though I can't take action. So to figure this out, to figure out what type of coping strategy you want to use, we're going to start with step 1, which is to identify what is controllable and what is uncontrollable about a stressor that you are experiencing. I like to use the example of a snowstorm to just illustrate this. Thankfully, at least here up north, we're getting out of the winter, but maybe you've all experienced a snowstorm or maybe a hurricane. Think of something weather related that normally would feel completely out of control, and then I'm going to challenge you to identify the things that are controllable. I did this one for you. The uncontrollable I always do first, because those are the easy ones. The fact that a snowstorm is coming and how much snow, or what areas will get hit the hardest, whether there will be power outages, will there be road closures. But what is controllable? Well, I can stock up. I can stay with a friend closer to work if I'm worried about getting in on time. I can leave or early from work at the end of the day to avoid dangerous conditions on the road, or I can move my car off the street for the snow plows. So there are things you can do to make that snowstorm less stressful on you. So now let's think of your own stressor, if you will. And for this, I want you to write into the chat, and Susan can read off the chat. What are the uncontrollable things about the stressor that you are experiencing right now? And I want you to just name, you don't have to name your stressor, but you can just name what's uncontrollable about it. And for some of you, that might be pandemic related, it might be work related, it can be family related. But please just share with us a little bit about what you feel is not in your control.
We'll give them a few seconds to think through.
Great. And often when we're thinking of something uncontrollable, it can be as simple as the fact that this is happening. You know, the fact that there's a pandemic, the fact that my work has been affected, the fact that I haven't had childcare.
So some things that are coming through is, how long will this continue? When will we be able to go back to our regular lives? Will it be safe? Kids in school, homeschooling, on top of all of the other things that we're tasked and responsible for.
Yes. Yes. Thank you so much to everyone for sharing those and for being vulnerable with me right now to talk about those as a group. So now I'm going to ask you, in response to that same stressor, the thing that you said was uncontrollable. For instance, when will this end, right? The end date of this is uncontrollable. The fact that I've had to homeschool my children is uncontrollable. So now what is controllable about that stressor for you? When I do this with my patients, often things come up like the oncologist that I choose. Now, some people have choices around their surgeon or the oncologist or the place that they get cancer care. Some people don't. And so we always have to think on an individual basis. But I also encourage my patients that, even their choice to show up for treatment is controllable. And some people resist and say, no, that's not a choice. I have to do this to save my life. But yet it still is. It still is a choice to show up for a debilitating treatment. So Susan, did anyone write in any controllable stressors?
Not quite yet.
It's always harder to think of these. It's always harder to acknowledge.
I can think of one that I can just throw out that would be controllable, just related to some of the schooling. Some of it is also when, some of us had the choice of when we helped our kid with homeschooling and hybrid learning, and others didn't. But for those of us who did, that was a controllable event. Being protective with exercise, even walking, proactive.
Yeah, and maybe, controllable in terms of the pandemic are things like the precautions I choose to take. You are in control of the behaviors, what risk behaviors you decide to take on as a family.
That's right. Another controllable that came through is who I share my stressors with. It's controllable, right? Or who I share my time with during times of stress.
I'm so glad you said that, because that will segue nicely into when we talk about social support and how to expand social support for your toolkit. And that is absolutely true. Who I choose to lean on and how I lean on them can either exacerbate your stress in some cases or can mitigate it. For those of you who are doing some hybrid learning or are wondering, when do we go back to school, having the information you need, finding credible sources of information for the risk behaviors you choose. And I call them risk behaviors you choose to take, because we are all choosing on some level what exposure we are comfortable with. And maybe we're taking some points in one area, but not doing some things in another area. And it's balancing out for us. But that is something that's in your control. So once we've sort of identified what's uncontrollable and controllable, that was step one. And step two is to choose the coping strategy that matches the controllability of the stressor. So if it was, if the stressor for the uncontrollable things that you identified, you probably want to be choosing an emotion-focused strategy. If you can't do anything about it, then you want to figure out how to, again, soften that relaxation response, soften the stress response and increase the relaxation response. If, though, you're focusing more on the things that were controllable about your stressor, then you want to think about these problem-focused strategies because you can do something. So the things that you guys said were in your control, you might choose to make a decision about. So some of you said, someone said something about walking, right? Or choosing to be active or taking that time, protecting that time. That might be a goal that you decide to set here. Or you might engage in some problem solving to figure out, how can I build this time into my day? Maybe for those of you who are trying to figure out how to do this hybrid learning for your kids or when they might be going back to school, it's about seeking information or advice or building a team around you that can assist with that. Maybe for those of you who mentioned, forgetting now the other controllable things that people mentioned, but the social support one, that's what I wanted to say. So with social support, again, choosing who's going to be around you. And that's sometimes making a decision, just like we talk about making a decision about treatment, it's making a decision, who am I going to call? Who am I going to ask for help? And what type of help am I going to ask them for? And maybe how will I phrase that request? So these are all things you can do. I can take action, and that serves to actually change the stressor. But the emotion-focused coping are the uncontrollable things. If I can't resolve the situation, what can I do to manage the discomfort? And these are things that are so individualized for each of you. I want you to think of these as your own self-soothing activities. For someone, playing video games might be really self-soothing. For someone else, that is totally stressful and activating and not at all relaxing. So you have to think for yourself about what things here or that are not on this list really do it for you. Sometimes we have to start with one or the other. But before I talk about that, I did want to just put up the next poll. Where do you think you often fall? If you had to pick one, are you really a problem-focused coper? Are you more likely to use these problem-focused techniques? Do you have a to-do list and you love checking it off and that's what makes you feel like you're managing stress? Or are you an emotion-focused coper? Do you find things to do that bring down your stress level? Do you sort of need to retreat sometimes from the problem and just bring down your stress before you can figure out what to do about it? I actually have to answer these polls also as the speaker, so that's been fun. I get to think critically about myself too. So this is what we often see, is that most people are problem-focused copers, and almost, this is sort of very reflective actually of what I see in my practice as well, working with patients at the Cancer Center, is that people on average are really good at making to-do lists and checking them off and identifying the things that need to get done. Especially, this year, there haven't been as many things to do, to check off. And I think that's why a lot of us have been struggling. I'm a problem-focused coper myself. I'd like to know what I need to do to fix it. And when we can't fix it, we have to turn to this box. And that's why I spend time here, is because, and you're going to hear me say this a lot, but I'm going to challenge you again to think about, how can I do more of this? For those of you who are emotion-focused copers, that's great. And if you feel like you're doing less of this problem-focused coping, then maybe that's an area you want to focus on. But for those of you who are not able to do this emotion-focused coping, think of something on this list, or I'm going to display another list in a few slides from now, and what you might want to do more of. The last thing I'll say on coping is that, as I mentioned, you might choose one or the other first. So sometimes you need to take action and then you're waiting. There's nothing else to do, right? You just have to figure it out. You just have to sort of sit with the stress. That's when I would suggest you shift over into emotion-focused coping, because there's nothing else to do. Maybe you're waiting. Maybe you just need to wait until the CDC guidelines change. Maybe you just need to wait until you get your vaccination. And so that's when these strategies come in handy, relaxation being one of them. Sometimes, though, we need to sort of bring down the stress before we can figure out how we want to act. And that's sort of like sleeping on it for a night, or I just got to take a walk. I have to clear my mind. And then I come back and I figure out how I want to tackle the problem. If you're taking too much time in either of these, then you'll probably experience an increase in tension. For instance, if you take too much time in emotion-focused coping and you don't address the problem, that is not coping anymore. That is procrastination or denial or withdrawal. So we do need to know how to move in and out of these coping strategies as the situation evolves so that we're doing the best we can for ourselves. Okay. Moving on to number 4, changing how we think about things. For those of you who know a little bit about cognitive behavioral therapy, this is sort of the core of the C in CBT, cognitive restructuring. The idea here is that your thoughts are not facts. However, when a thought pops into our head during the day or in response to a stressor, we often feel like this is definitely true. There's nothing, there's nothing I can change about this. So I want you to use these things to challenge yourself. What can I change here? What might not be true about this thought that I'm having? Or what would I say to someone else in the situation? And challenge yourself to think, this is not necessarily a fact, and how might I think differently or appraise the situation differently? The social support, and I know we're getting to the 2:45, so I'll wrap up in the next 5 minutes. With social support, we have 3 different types of support. The practical, meaning things that people can do for us. The emotional, being more of receiving warmth or encouragement or providing that for others. And informational, as it sounds, guidance and advice and things like that. I'm not going to have you write into the chat just for the sake of time, but think about what you feel like you really have in this category and where you feel like you might need more. So I have a lot of practical support. I have people who do things for me. I'm just kidding. I don't have that. Who has that right now? This is all things that we probably need more of, right? Things for people to come babysit our kids or to help with homeschooling. That's an area that right now we might not be able to get more of. So maybe can you come up a little bit on the psychological support? And the other piece from that is, who are you identifying? So is it friends? Is it relatives? Are there acquaintances? Is there anyone on this list that you haven't asked for help and you might be able to ask? And then here are some strategies. And again, you'll all get the slides, so I encourage you to read through these, identifying what type of support do I need, practical, emotional, or informational? Who can I rely on this for this type of support? What are the barriers to me receiving the support I need? Am I willing to ask for help, or do I think needing help makes me seem weak? And how can I reframe my thoughts around support? And that's when you can actually use the boxes from the thought reframing slide to challenge yourself and to be able to seek support more readily. I mentioned I was going to give a really brief primer into acceptance and mindfulness. Acceptance being learning how to ride the wave. That means we don't have to approve of something. I don't have to approve of the fact that this pandemic is going on and it affects my work life and my home life and how I care for my patients or how I care for my family. But I do accept that it is happening, and that allows me to find ways to work within it. I can let go of what I've been resisting against and sort of soften and say, it's okay to not be okay, but how am I going to make this work? And then mindfulness, again, really brief primer, but it's awareness of the present moment where we're maybe observing and describing, even kind of going back to the grounding techniques, just what I'm feeling in this moment without having to change it. Activity planning and pacing. So for those of you who mentioned that weight gain was an issue right now, or are having a lot of fatigue. So one thing is to think about, How active am I being on certain days? And is that causing me to sort of be really inactive on another day? So maybe I'm having a good day where I'm not feeling too tired or too burned out at work. And I feel like I want to get all the things done in the house. I'm going to clean everything, or I'm going to really go for that run today. And then do you overdo it? And so we want to get to a place where activity necessarily isn't looking like mountains and valleys, where we're really active one day, but then not so active another day. Find a bit of moderation here where your activity levels look more like rolling hills, that you're maybe not as in high activity, but on other days you're not super underactive. And that keeps you from sort of staying in states of underactivity for long times, or for just establishing habits that are more sustainable over time in terms of being physically active. Reevaluating your pie is one that I love when we're thinking about how to reincorporate activities. And this is as simple as, what are the things that I used to like to do that I'm not doing enough of? If I'm not succeeding in one area, is there another area of life that's simple that I can feel accomplished in, that makes me feel whole? So again, I encourage you to look through this list and identify if there's something on here, and there's plenty of lists like this out there on the internet, that maybe you want to be doing more of. And then plan your activities based on how you feel. So an A day is, I'm feeling really good. I'm not feeling too burnt out. I'm feeling like maybe I've got this down, this homeschooling thing or this hybrid thing, and I'm able to do things. So I'm going to have activities pre-planned that are my A day activities. And then some B day activities, I'm feeling so, but I know I'm still going to be able to get some things done. And then C days, I'm really not feeling good, but the idea that I can still accomplish a few things makes me feel like I didn't have a total wasted day, which might lead to some symptoms of depression, or just overall feeling down or sad or disappointed in yourself. So plan your activities in advance. And these are just your general self-care reminders for the last thing that I'm going to talk about today, setting an intention for self-care. So look at this list and think of something, or maybe it's not on here. Maybe it's sleep for those of you who mentioned sleep. Maybe it's social support for those of you who mentioned social support. And I want to challenge you to set an intention using these 6 steps. What is something I used to like to do? Maybe it's on one of the lists of, on one of the slides I presented. Can I incorporate it back into my life? Or if not, do I need to do it differently? And be creative about this. What might get in the way? How will I overcome that obstacle? And then make a plan. If you know someone who also wants to set an intention for self-care, I really encourage you to do this as in twos. We had been thinking about doing this in a breakout, but we decided not to. We weren't sure how many people would participate, but I think this is a nice thing to do as a couple. For one couple I worked with one time, and this was the most creative example I've ever had, is that they said, we used to love to travel. Obviously, none of us can really travel, or maybe some of us have figured out how to do it safely. But on average, I think we feel pretty trapped in our homes. And this couple decided, well, we're going to pick a place that we wanted to go, maybe in this case, Greece. And we're going to watch a tourism show on Greece that night and order Greek takeout from a restaurant we've been wanting to try. And that was their way of traveling to Greece. What it accomplished for them was a sense of connection that they really enjoyed when traveling together, that they would discover new things together. And it also blocked out time, protected time, as someone in the chat said, for them to be together as a couple. This is definitely by far the most creative example of this exercise I have ever had, and I don't take credit for it. Sometimes it's just, I want to get back to exercise, or I want to get back to eating healthy. So it doesn't need to be so creative like this, but I give you this example because I encourage you to think out of the box. And so your challenge after, taking this time to focus on yourself is now also to set an intention for self-care after we finish this session, and hold yourself to it and do a check-in later in the week to see, did you meet these goals? I'm just ending with, if you are feeling so overwhelmed, so burnt out that, or other symptoms of trauma or symptoms of stress that you feel like your coping strategies aren't working for you, either to seek help with a therapist or a counselor, and of course, if you're in crisis, here are some phone numbers and other sites that you can go to for help. And that's it. I hope we have some time for questions, and I'd be happy to answer anything or elaborate on anything that you might be interested in.
Great. So this is your time for those of you who were able to carve out a bit of time today to put some questions or some comments either into chat or into the Q&A box here at Zoom. So Dr. Jacobs, a question that comes up is, how do we do this when we feel so exhausted? You know, unlike maybe other life storms, this one has gone on for a really long time. And not only are we living this experience, but we're serving the cancer community who are living it as well. And they have a health crisis. You know, I know that sometimes when we're feeling so exhausted that we don't even know how to start.
I think that is such a valid question. And I really appreciate the comment about living this disaster alongside our patients, because I think that has been one of the most unique facets of providing care during this time, is that often, more than not, we're not experiencing the same stressor that our patients are. And so we can lend a perspective perhaps, or it's easier to take perspective. And this is different because it sort of feels like we can't even escape from, you know, maybe if something's going on at home, you can go to work and you can escape it. But this is just surrounding us because we're dealing with it personally. And then we're also helping our patients navigate it, as well as, like you said, navigate their own health crisis. So my advice would be to pick one thing. A series like this is so wonderful because I'm presenting you a toolkit. I'm presenting you lots of things, but I want you to think of it like a box of chocolates that you're going to like some and you're not going to like others. Some are going to work for you and some aren't. So I want you to just focus on one thing that I presented today, or something else that you've been trying to do, and just take small steps. Think of it like SMART goal setting, for those of you who are familiar with SMART goal setting: specific, measurable, attainable, realistic, and timely. I wasn't sure if I was going to remember that whole acronym. And really just start small. So maybe the physical activity is a walk around the block, because I know, like you said, the exhaustion is so real. And when it sets in and becomes and gets to the level of burnout, it is hard to even initiate. This is the core of behavioral activation, which we do for depression, where you force yourself to sort of do something in like a fake it till you make it way. If you walk around the block once every day, eventually at some point, maybe day 4 or day 5, you're going to realize, oh, I'm actually enjoying this a little bit. Or I finally feel that sense of relief I've been looking for. But it's not going to happen on day 1 or 2 or maybe even 3. And with physical activity, when we're trying to get back to the gym or do something active, it's always uncomfortable at first, but there's that hump that we get over. So if you're so exhausted that you're having trouble initiating, I would put it on your calendar and make it a chore that you have to do, like brushing your teeth. And just do it until finally you get some positive reinforcement from it, until finally it starts to feel good. And then it will become more natural and it will be naturally positively reinforcing. But at first, you just have to schedule it like you would eat breakfast, lunch, and dinner. That's my advice on that one.
We have a question that came in. The question is in regards to CBT for insomnia. You mentioned some training websites. Do you feel that individuals can train themselves with CBT to mitigate insomnia? And if so, can you suggest any websites or include in a resource list?
That's a great question. There is one site that I know of, and I don't remember it offhand, so I have to do some Googling to get to it. And I can send that to Susan or Kara after the talk if the organization is comfortable distributing that. Whether or not you could do it self-guided, I think depends on your mental health background. I know some people on this call have backgrounds in social work or in counseling, and I think that, it's one of those things that would probably be more helpful or more effective with a therapist, but it's not something that you can't do on your own. CBT for insomnia is a combination of sleep hygiene, which usually I think people can implement to some degree on their own, thinking about what is in the room with you, like the TV or the iPad or the phone or other noise, thinking about setting a bedtime, setting a wake time that you stick to, not drinking or eating too close to bedtime. We call it all of that sleep hygiene. But the other component of CBTI is the sleep restriction, where we actually purposefully shorten the amount that someone is sleeping each night to build up sleep pressure and to get them to stay awake until they actually are so tired that they're able to finally fall asleep, and pretty quickly. That part sometimes needs a little bit more guidance because there's some tweaking that can happen, and sometimes it takes also some external motivation to get there because it's one of the harder parts of CBTI.
Great. Well, we are at the conclusion. Wow, Dr. Jacobs, this was great. I needed this, and I'm hoping if I received such incredible self-care today, I'm hoping that all of our attendees did as well. So thank you for not only the presentation, but the clear love and passion you put into it as you were thinking about all of us. I think I have control right now of the screen because I would like to really acknowledge our sponsors. We were able to put this 7-series program together because of Merck and Takeda, and we're so grateful to them for that. There was a question that has come in about, will you receive the slides? Is this being recorded? All of that is true. In addition, at the conclusion of our 7-session series, attendees will receive a first aid kit with some of the pro tips that you'll learn week by week, and other resources that can guide your path. These are for you, the professional. And while many of you might be putting your clinician hat on how you can use these skills for your patients and the caregivers that you serve, we think that's wonderful, but we also want you to know these are absolutely for you, your time, not only for self-care, but for self-reflection, really to get off the wheel of doing and just, move into that space of being. So we hope that you will attend again. Please mark your calendar. We have fabulous programs coming. In a couple of weeks, Dr. Jamie Atten, who is a disaster specialist and a cancer survivor, is going to talk about fortitude. So if you're so wore out, how do you keep going and how do you recharge? So mark your calendar, send the information on sessions to your colleagues, and because all comers are welcome. And for more information, Kara has been our guide. I want to thank her for putting these programs together. And at the end of today, you will receive a survey because we want to know how we did and what we can do better. So again, thank you so much for joining us. May today and tomorrow be reminders that your work is a gift, and that you deserve a commitment to yourself. So thank you, Jamie.
Thank you so much for having me, and such beautiful words to end with.